So a lot of the things, wire loose hai shayad. Lot of the things have been covered. My main emphasis is fixed rug. नहीं, ये wire loose है बेटा ये. Is the compliance is better and the less preservative exposure with fixed drug combinations. Here I would request all of you to look at the highlighted points. Just look at the highlighted parts, and with the just to reiterate a few things, fixed drug combinations, the number of eye drops instilled is less, washout effect is less, local tolerability is better, convenience of administration, compliance, and exposure to preservatives. Again, please look at the highlighted ones. 60% or 60% of glaucoma individuals will have ocular surface disease, and they present as hyperemia, tear film instability, stinging and burning and dryness. This has already been covered, but I would tell you where the last one. Again, look at the highlighted ones with the topical CAI, 2018, this came closest, but it failed. And in India, this was bimatoprost, brimonidine and timolol. We are talking about the triple drugs here, because I'm going to be talking about the new triple drug combination. So this one came into, I think, phase 2, came into phase 3 also, but it failed. This was last in 2014, and worth mentioning, it was from an Indian doctor. So the triple drug combination has been developed. I think it's the first, you can correct me Abhijit, it's the first in the world. Yeah, this formulation we are talking about. And I think the results have been pretty encouraging in my own experience. And we'll have discussion with the others. I'm sure they will agree the results have been encouraging. And it was, the Trisopt of course is the name. And like I said, same things, the reduction in the total number of drops, improved compliance, avoids washout, reduces the risk of OSD, cost benefit, and an ease of adding or another drug. Abhijit, can you tell us about that cost analysis that you did? So quickly. Yeah, take the mic.
Yeah, so 490 against individual drugs, you give it in separately, it's around 1000, and if you give 2 plus 1, it's around 800. So that's
what he's saying, that the present market value of this triple combo is less than 500, and if you give the 3 ingredients separately as 3 bottles, it would be 1000. If you combine 2 of them as a combo in 1 bottle and give the third separately, it would be what? 800. So I think that is the actual data cost benefit. Please keep that in mind also. So I think importantly, please know that brimonidine, what you're giving otherwise, it may be as 0.1 or 0.2 or 0.15. This one has 0.2. Brinzolamide is 1% and timolol is 0.5. And arguably still, brimonidine will have 0.2 will have the highest efficacy in IOP lowering. So it's the first one. It crossed the phase 3 trials also. Like I said, the last Indian study with different triple ingredients that failed from Meena Menon. This one crossed phase 3 also, and the ingredients I just told you. So it was basically this. The baseline and week 12 was studied, and change from this is the primary efficacy. Secondary efficacy is a change in the baseline at the end of 2 and 6 weeks. But basically, the week 12 was what we were after, but we also studied 2 and 6 weeks results also as secondary. So 10 centers across India, were they scattered all over India, Abhijit? So that's important. It was a pan-India thing. It wasn't one zone, say north or south. That gives you, there is some racial difference in the IOP effect of different drugs in India that we know. So the 10 centers chosen by the company was across India, 200 eyes, and I'm sure the data, Abhijit, the data has built up even more now, more than 200. It may not be this, but of course many more patients are taking it now. And basically on 2 drugs, patients included were already taking 2 drugs. That may be in a dual combination or 2 individual drugs. And then also the IOP on these drugs was 22 to 32 in one eye. So this was the inclusion. So 210 subjects. I think we'll skip the rest of the epidemiology figures, but 210 is the number to remember. And the reduction in IOP, as was shown by Aurojit in a line, but I'm showing you in a bar diagram, 25.68. Remember, the inclusion was patients on 2 drugs having 22 to 32 IOP. So that is the average, baseline 25 or 26. And at week 12, remember week 12 was the primary endpoint, it is dropped to 15. Even if you don't get so much result in everyday practice in all patients, still the drop is significant. So we are quoting this study, so it's a pretty, this line has already been shown by Aurojit. So 32% at week 2, week 6 was 57% reduction, and week 2 and week 6 were the secondary endpoints. Primary endpoint was again 86. So I think these are pretty dramatic numbers. These are impressive numbers to remember. The treatment response rate, 18, greater than 18, greater than 20 were 4, greater than 22 were 2, and IOP was 24. So I think the large cluster we were able to get below 18. Aurojit said get it below 14. I think below 18 is what we are after in most of our patients. Venkatesh, you would agree with that. We are after less than 18, and I think these are pretty impressive numbers, that a lot of the proportion of patients got it to less than 18. Importantly, whenever you introduce a new drug, yes, you look at the good part, but you are more concerned about the bad part, if at all. So the general well-being of patients, remember it has brimonidine, which can cause lethargy and drowsiness in the elderly. It has timolol, which can have potentially have all sorts of side effects on the body. So the general well-being, this green number or this green color of the pie chart, and by the way, this was not made by Prasanna for a day change. So, so most of the patients had a very good general well-being. So that is pretty good. Greater than 95% were tolerating it pretty well. So 92% here, you can see here, and hardly anyone had poor tolerability. Please again look at the blue highlighting. These were what was studied, standard things. So I think let's not go into these. Gonioscopy, anterior segment, perimetry, and ocular signs and symptoms. Adverse effects, like I said, very important when you launch a new drug, which has never been seen anywhere in the world also. It's a first in the world, I can say. Please look at the last line of the slide. None of the adverse events, this is adverse event, required discontinuation of the drug or the bottle, and all the reported adverse effects resolved without treatment any sequelae. And what was those ocular adverse effects? They are expected with almost any glaucoma med, were dry eye, burning sensation, redness, and itching. So nothing out of the blue. This is a very, very important thing for me, which was studied in those 10 multicentric study. Reduced preservative. I think these are the 2 take-home numbers for all of you. So please look at this bar diagram very carefully. If you have to take 2 figures from this whole presentation, look at this. The 3 drugs which is in the blue, the percentage reduction in preservative is 60%. I think this is very, very important. This still has BAK, but still overall the amount of BAK was reduced by 60% compared to the 3 drugs if you could give individually. This, I think, is the highlight of this whole set of slides that I'm talking about. And you can see that with the when 2 drugs are given and a 3rd drug is added, then it's less than 33. So I think this is doubled or rather half the preservative exposure, and 60% reduction in preservative exposure. I am a big believer in preservative-free or BAK-free drugs in my general glaucoma practice. Would that be a good thing to say? So 60% is pretty impressive. So also the good thing is why these 3 drugs were chosen is the complementary mechanism of action. So you can see that enhances uveoscleral outflow, decreases aqueous humor production, increased ocular blood flow, which is brinzolamide, neuroprotective, if at all, it is brimonidine, and overall complementary mechanism, better compliance, reduced preservative, and efficacy. So I think this is what I had, but before Prasanna comes in and steals my show, I will ask Venkatesh to give his thoughts on what your initial experience, if you've used that as a triple drug.
Yeah, we are already using. I mean, I personally, my department is using. I've been closely asking them because I don't see much patients these days. But it looks like it's definitely effective, but we need some time to say how effective in intraocular pressure control. But what you say, the other things are regarding compliance and getting lesser preservative and all that is more of long term to see whether this really works. But definitely it's going to stay, and
Great.
it's going to have, we're going to see more combinations like this in the future. I mean, it pushes the interest of us and others to see how, because the patients are demanding. The patients want to be even drop free, but if you're going to reduce the number of medications by putting everything into one particular
number
bottle,
of daily drops we are reducing.
they are going to drive the market. Already it's been driven by, to some extent, our customers or the patients. So this is helping us to at least bridge that gap. This particular formula now we have, but in the future we may have more also.
So I think it's been now up close to 5 months, or November, I think we launched it. So I think 5 months is fairly a good time. My own, though I don't have a compiled data, but I think there was initially a problem here in Delhi. I come from Delhi. There was a problem of the availability, because I think a lot of the doctors were writing more and more, so the company could not fill the shortage. But now I think things are better, so we'll be able to get that data. Arijit, what's your one-line experience in those 5 months? Give a mic please to Arijit.
Actually, initially, since we were a little bit skeptical as to how the drug is going to work.
Everyone was, including me.
So we kind of used it in patients like neovascular glaucoma already on multiple
More
drops.
secondary glaucomas.
Yeah, so those patients, we could not really understand the efficacy of the drug. But later on, when we started using it in either treatment, patients who've been on 3 separate drops or an FDC plus a prostaglandin, and I've shifted it, I've got pretty good results in patients.
And no remarkable adverse events.
No, as of now, no.